cardiovascular system examination. But first, we have to fight off the germs. So I'm going to teach you my 5 moments of hand hygiene. First, before touching a patient, before clean and aseptic procedures, after touching a patient, after body fluid contact, and after patient surrounding. Is that clean, soldiers?
Sir, yes, sir!
Hands out, soldiers. Follow my lead, soldiers.
And I'll be doing your general examination today. Do I have your consent?
Yes.
Okay. Based on your general appearance, everything looks normal. Your face doesn't show any signs of flushing or redness or anything like that. Your breathing looks pretty normal. Have you had any difficulty breathing lately?
No.
Okay. You have a very healthy weight. You don't have any obesity or anything like that. Have you had any sudden weight loss?
No.
Okay. Have you had any pain or anxiety lately?
No.
Okay. The last thing I'd like to look for is your hands for signs of clubbing and cyanosis. First thing I'll be looking for is the angle between your nail bed and your actual nail, called the hyponychial angle. And what happens is when you put your 2 fingers together like this, can you please do so? If you look closely, there's a little diamond which indicates that you do not show signs of clubbing. Okay. The next thing I'd like to look for is your nails. Okay. This is a nice healthy color and it's not blue, which would indicate peripheral cyanosis, but everything is okay.
Good afternoon, Mr. Ndo. My name is Dami, and today I'll be performing a hand examination on you starting from your nails. Do I have your consent?
Yes.
Alright, thank you. Can you please give me your hands? Alright, looking at your nails, I can see that you do not have any splinter hemorrhages, which is indicative of infective endocarditis, which is quite good. And I can also see that your nails are a lovely pink color. If they were red, then that would have been indicative of polycythemia. Which just means that your bone marrow would have been producing way too many red blood cells because of high carbon monoxide levels and low oxygen levels. Now, looking at your nail beds, I can see that they have some color to them, and I can also see that your nails are not spoon-shaped, so you do not have koilonychia. If you did have koilonychia or pale nail beds, then that would have meant that you're anemic, but you're not. Alright, do you mind turning your hands? Alright. I can see that you do not have sweaty hands, and I can also see that your hands are a lovely color, so they're not yellow, which means that you do not have jaundice. And looking at the palms of your hands, I can also see that you do not have nicotine staining, and you do not have Osler's nodules. And looking at the palms of your hands, I can also see that you do not have Janeway lesions. Now, if you did have Janeway lesions or Osler's nodules, then that would have also been indicative of infective endocarditis, which is basically just the infection of the septum or the valves in your heart. So that's actually quite good. Now, do you mind turning your hands down again and flexing them, but not too much? Alright, now I am feeling down on the tendons of your hands for papules or nodules to test whether or not you have tendon xanthomata. And so far so good. Alright. I can see that you're quite clear for tendon xanthomata. If you did have tendon xanthomata, then that also would have been indicative of infective endocarditis. So, judging from the general appearance of your hands, I can say that you're actually quite healthy. Thank you.
Thank you.
Good afternoon, Mr. Ndulu. I'm Leah Bonner, and today I will be examining your face and your eyes. Is that okay with you?
Yes.
Thank you. I can see by the colour of your cheeks that there's no sort of rosiness and there's no bluish tinge, so we can assume that you do not have mitral facies, which is associated with pulmonary hypertension. I'm now going to move on to your eyes. Is that okay?
No problem.
Okay. Just going to open up your eyes. Please, would you look up for me? I can see that there's no sort of yellow discoloration on your sclera, so we can clear you off for jaundice. And also there's no pallor. That means you do not have anemia, so that's good. I'm now gonna, okay. I can see that around your iris there's no sort of white, grey or blue ring, so we can clear you off for arcus senilis. I'm now going to ask you to close your eyes for me, please. There are no sort of yellow fatty deposits around your eyelids, so we can disregard xanthelasma, which is caused by higher cholesterol levels. Okay, thank you very much.
Okay, thank you.
Good afternoon, Ms. Ndou. I'm Michaela, and today I'll be examining your mouth. Do you have your consent?
Yes.
Cool. Would you just open your mouth for me? Thank you. Firstly, I'll be checking for any cavities, which is a risk for infective endocarditis. This is the infection of the heart valves. This is absent. Secondly, you do not seem to have a high arched palate. This is good. Will you please stick out your tongue for me? Thank you very much. You do not show any signs of central cyanosis in your tongue or peripheral cyanosis in your lips. And lastly, you show no signs of jaundice in your buccal mucosa. Thank you very much.
Good day, Mr. Ndou. My name is Tembi. I'd just like to assess you for lymphadenopathy by just feeling for lymph nodes in your neck and head region, if that's okay with you.
That's okay.
Great. Could I ask you to take your shirt off, please? Okay, I'm going to start with the lymph nodes located in the supraclavicular region. They're deep to the supraclavicular fossa, and I'm just feeling for small nodules. Next, I'll move on to the sublingual lymph nodes, and then work my way along the submandibular lymph node region. Next, I'll be doing the cervical lymph nodes, which are arranged in a Z formation along the length of the neck. They are deep to the sternocleidomastoid muscle and shallow to the scalene muscles. Next, I'll be doing the pre- and the post-auricular lymph nodes, which are before and after the ear, respectively. And lastly, I'll be checking for your occipital lymph nodes, which are at the back of the head, just above the neural line. I don't seem to be finding any lymph nodes, which is just indicative of the fact that your lymph nodes aren't swollen. So everything looks good.
Okay, thank you.
Thank you very much.
Hi, good afternoon, Mr. Ndou. I'm Akila Gulam, and I'm going to be checking if you have any signs of edema. So edema is basically the buildup of body fluids, and due to the buildup of those fluids, your tissues will become swollen, and this is often seen in the lower leg and ankle region. So what I'm going to ask you today is if you could please just remove your shoes and then just place your legs on the bed for me. So Mr. Ndou, I'll be assessing two regions of your body to check whether you have any signs of edema. So the first place I'll be checking is your sacrum, and I will be applying pressure for about 10 seconds. Okay, there's no indentation left, which means you have no sign of pitting edema. So the next place I'll be checking is the distal region of the tibia. So I'll be applying pressure for about 3 to 5 seconds. Okay, that's good. There's no indentation, and that means you have no clinical signs of edema.
Okay, thank you.
Disclaimer. In order to continue the cardiac examination, you have to make sure that the bed is at a 45-degree angle. As you can see over here. As well as the room that you're doing the cardiac examination in should have adequate lighting.
Good afternoon, sir. My name is Victoria Beaker, and today I'll be assessing your arterial pulses. Do I have your permission?
Yes.
Wonderful. Before we get started, I'd just like to explain that there are 4 characteristics that we look for when examining the arterial pulses: the rate, rhythm, volume, and character. The rate is how fast the heart is beating per minute, and we would hope that it lies between 60 and 100 beats per minute. Anything below 60 beats per minute is classified as bradycardia, and anything above 100 beats per minute is tachycardia. The rhythm is regular or irregular, and if it's irregular, we can further classify that as either regularly irregular or irregularly irregular. And we've got the volume and character. Right, so we'll start with the radial pulse, which is palpable over the distal radius using the forefinger and middle finger pulse. We will count the number of beats over 30 seconds and multiply that by 2 to get the beats per minute. Okay, so your heart rate is 80 beats per minute, which falls in the healthy range. From the radial pulse, we find our rate and rhythm. Then the brachial pulse, if you just flex your arm very lightly, just medial to your tendon, okay, relax, we will find the brachial pulse. And here we can find the rate, rhythm, volume, and character. Moving up to the neck, can you just move very slightly to the left-hand side? Okay, there we go. And I'm feeling for your carotid pulse. You can look back at me, and from here we find our rate, rhythm, volume, and character. Other arterial pulses include the femoral, which is found in the groin. We can look at our popliteal, which if you bend your knee at a 120-degree angle can be palpated just below the knee. We can look at the posterior tibialis, and very lastly, the dorsalis pedis. Okay, and we want to make sure that everything is bilaterally symmetrical, so whatever's on the left-hand side will repeat on the right-hand side. And that concludes the examination of our arterial pulses. Thank you.
Thank you.
Good afternoon, Mr. Ndo. I am Mihlali and I'm going to be assessing your JVP. Do I have your consent?
Yes.
Thank you, Mr. Ndo. Can you please look to the left for me? So we first need to identify the sternocleidomastoid muscle, which is this one, and also your sternal head and your clavicular head, as your internal jugular vein lies between your sternal head and your clavicular head of the sternocleidomastoid muscle. So your JVP pulsations tells us information about the functioning of your right heart.
So if you can just bring your head back forward for me. And then with the good lighting, we can see that the little pulse over there. I'll now put a mark by the top of the pulse. And then I'll be measuring your JVP. So I'm putting my one ruler on the 0 point on the sternal angle and my other ruler at the top of the pulse. And we're measuring the JVP. And that's below. This is below 3 centimeters, so that's healthy.
I will be inspecting your precardium area. Is that okay with you?
No problem.
Cool. Firstly, your chest is normally shaped, it's not funnel shaped. Secondly, I do not see any scars or lesions indicating previous cardiac injuries or operations. And lastly, I do not see any pacemakers under your skin. I am now looking for your apex beat, which is situated 1 centimeter medial to your mid-clavicular line in the 5th intercostal space. And it is present. Thank you very much.
Hello, Mr. Ndo. I'm Philippine Malumani and I'll be examining your apex beat. Do I have your consent?
Yes.
Okay, thank you. With a finger, I'll locate your sternal notch, then move down to locate your sternal angle. In line with it is the second rib. From there, I'll count downwards until the 5th intercostal space. So just below it is the 2nd intercostal space. So that's the 2nd intercostal space, 3rd, 4th, and the 5th intercostal space. So after that, I'll locate your mid-clavicular line. So there's your clavicle, right? And there's the middle of the clavicle. So that's the mid-clavicular line. And then just 1 centimeter medial to the mid-clavicular line, that's where the apex beat is situated. With the palm of my hand, I'll palpate to check if your apex beat is displaced. Okay, great. It's not displaced. So if it was displaced, that would have been due to left ventricular hypertrophy or a dilated left ventricle. So it's not so in your case. And now with the tips of my fingers, I'll palpate for the point of maximum impulse. Okay, that's great. Okay, that's great. A normal apex bit will gently lift the palpating fingers, and yours seems to be doing so. So perfect. You seem to be healthy.
Hi, Ms. Sendao. I am Janae, and today I will be palpating your heart valves to see if there are any thrills or heaves. And then after that, I'll be percussing your precordium to determine the superior and left border of your heart. Do I have your consent?
Yes.
Okay. I'll first identify the landmarks. So we identify the sternal notch, move down towards the sternal angle. Just to the right of this is your right rib, and moving down is the second right intercostal space, and parasternally this is the aortic area. Then we move to the left rib, and down from this is the left second intercostal space. Parasternally is the pulmonary area. Now if we move down, third intercostal space, fourth intercostal space. Parasternally, this is the tricuspid area. And then if you move down to the fifth intercostal space, just medial to the midclavicular line is the mitral area. Now I will palpate these heart valves to see if there are any thrills or heaves. A thrill is a palpable vibration caused by a turbulent flow of blood over the heart valves. So let's feel them. All good. All good. All good. All good. So I cannot feel any thrills, which means there is no turbulent flow over the heart valves and no diseased heart valves. So now I will be percussing your precordium to determine the location of the upper border of your heart and then also the left border of your heart. So we first identify the sternal notch, move down to the angle of Louis. Just to the right of this is the second rib. Below this is the second intercostal space. Now I will be percussing down the midclavicular line, down the intercostal spaces. The first sign of dullness will indicate the superior border of the heart. So I place my left middle finger into the second intercostal space, and I'll strike firmly with my right middle finger onto the left middle finger. The movement should come from the wrist and not from the arm. It's resonant. Third intercostal space, resonant. Fourth intercostal space, resonant. Fifth intercostal space, it's dull. So the superior border of the heart is usually in the fifth intercostal space, and in your case it is, so your heart is in normal position. Now to determine the left border of your heart, we will percuss medially or towards the sternum from the mid-axillary line in the fifth intercostal space. So we determine the fifth intercostal space, resonant, resonant, dull. And in your case, the left border of your heart is in the correct position. If the distance between the left border of your heart and the sternum were to be more than 9 centimeters or more than 10 centimeters, it would indicate cardiomegaly, which is an enlarged heart. But I can see no indications of cardiomegaly, so it's all good.
Good afternoon, Ms. Indo. I am Michaela Dan, and I will be auscultating your precordium. Do I have your consent to do so?
Yes.
Okay, cool, thank you. Okay, so we'll start off with the sternal notch. First, you will find your 4 areas where we can find the heart valves. Okay, so sternal notch, go down to find your sternal angle. We'll go to the right. We will be in line with the second rib. We'll go down to find the second intercostal space, and this is where we will find the aortic area. If we go across from the sternal angle again to the left, we'll find the second rib again, and we'll go down to find the second intercostal space. This is where we'll find the pulmonary area. So from the second intercostal space, we'll go to the third, third, and we'll go to the fourth. Okay, so the fourth intercostal space, left to the sternal border, we'll find the tricuspid area. We'll go down from the fourth to the fifth intercostal space, medial to the mid-clavicular line, and this is where we'll find the mitral area. Okay. Okay, so I'll be listening to these heart sounds now. Okay, so the first heart sound. Perfect. Second heart sound. Good. So your heart sounds sound as they should. The first heart sound, longer, lower pitched and louder. The second heart sound, shorter and higher pitched. And that is as it should be. And to be continued would be a liver and lung based examination. Thank you, sir.